All right, and I'm told that we do have Dr. Kogan with us from GW Hospital talking about vitamin C infusions and vitamin C in general. Good morning, Dr. Kogan. Are you with us?
Good morning. Can you hear me okay?
Good. I can hear you loud and clear. And tell us about this exciting link between vitamin C and, first of all, our immune system and how it works generally when it comes to coronavirus.
Yeah, so, the vitamin C is an essential nutrient, one of the essential nutrients. And, we know when somebody gets really sick with coronavirus, especially if the sickness progresses to the point where they have to be in an intensive care unit, we know that the deficiency in vitamin C sets pretty quickly. And over the last several years, there have been multiple studies, including a very large NIH-sponsored trial out of 7 different hospitals in the U.S., that demonstrated a 30% decrease in mortality when intravenous vitamin C is administered for patients with sepsis and adult respiratory distress syndrome, which is what currently is the biggest problem with the COVID-19, as of course you know. I do want to make a very clear distinction. We're not really talking about oral vitamin C. The oral vitamin C that we take either in food, people of course familiar with vitamin C in oranges and other fruits, that's a very different, it's a very low dose compared to the infusions. And while taking oral vitamin C may have some efficacy in potentially even preventing COVID, we don't really expect this to be a treatment per se. And it does help immune system, and especially if someone's diet is not high in vitamin C.
Okay, and we also want to make the distinction, no proven effective method to decrease the death rates from COVID-19. We're talking about a treatment for people who are in the ICU, say, to battle this disease. And we're showing a video of orange juice just because I think that's the way that most people think about vitamin C. But tell us the distinction when you talk about that IV. Is it just what we're thinking?
Yeah, no, so you can't really put the orange juice into your intravenous line. It's not going to work very well. No, so it's an isolated, pure vitamin C. It's a pharmaceutical drug called Ascor that's actually already been used in many hospitals in the U.S. You may have been following New York news that there is actually a multiple hospital in New York area that are administering this protocol already and reporting positive benefits. We have a lot of experience with this. Over a number of years, almost 200 hospitals in the U.S. have administered this protocol to over 140,000 patients. But of course, we don't know if this applies to COVID-19. We do know it applies to patients with sepsis and ARDS.
Sepsis, okay. FDA approved, so this is something to keep in the back of your head for when patients go in. I know a lot go in alone, but maybe to ask about this vitamin C infusion as an additional treatment method. Am I correct with that as we say goodbye?
Yes, I think the ICU attending could take the decision to administer. It's available in a hospital.
Okay, let's leave it there. Dr. Kogan, thank you so much for joining us this morning. Be well.
Thank you for having me. Goodbye.
All right. Angie.